Hello, everyone. This is Karen Bowles with the Virginia Early Childhood Foundation, and I'd like to welcome you to today's webinar, Expanding Families' Access to Childcare in Virginia, Strategies for Home-Based Providers. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to either join by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. All participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. And now a quick review of today's agenda. Angela? Can we move the slide to the agenda slide?
My screen is showing the agenda slide.
Okie dokie. Mine is not. First on the agenda, we're delighted to welcome Jim Dyke from McGuire Woods Consulting and one of the co-chairs of the Back to Work Virginia Task Force. Next, we'll hear from Duke Storen, Commissioner of the Virginia Department of Social Services, and then from Jenna Conway, Virginia's Chief School Readiness Officer at the Virginia Department of Education. And then we'll hear from Natalie Renew, the Director of Homegrown, followed by a discussion of Ready Network, a new initiative here in Virginia, and we'll have plenty of time for questions. So let's get started. I'd now like to welcome one of early childhood's most committed and passionate champions, Jim Dyke. As I mentioned earlier, he is co-chair of the Back to Work Virginia Task Force, which is focused on re-envisioning a stronger early childhood system in Virginia, and also is a senior advisor at McGuire Woods. Welcome, Jim. We're delighted to be able to hear from you today.
Thank you very much, Karen, and good afternoon to everyone. I'm proud to serve as the co-chair of the Back to Work Virginia Task Force, which, as Karen mentioned, is charged with reimagining how we can provide better child care in Virginia. Any effective delivery system must include, and I underscore must include, home-based family child care providers as a major part of the solution. That's why I'm honored to kick off today's discussion. Even before the COVID crisis, Virginia was not supporting and valuing the business of childcare in the manner that it deserves. The COVID crisis made that failure painfully evident. To get essential employees to the front line, workers like healthcare providers, hospital workers, and food suppliers, we need them to have access to safe, affordable childcare. When schools close or when they operate in virtual format, parents need accessible childcare. And that made it clear that childcare providers are themselves absolutely essential to a functioning society. For that reason, I unequivocally and strongly say to each and every one of you, thank you for your service. During this pandemic, we saw that home-based childcare providers, like many of you attending today, were more likely to remain open and operating. More than 80% of these providers have continued to operate this year, offering consistent and much needed support for families and their young and school-aged children. And many families feel more comfortable with the smaller group setting that home-based providers offer, especially as we all fear the spread of the virus. Employers also count on providers like you to help essential personnel get to their jobs so that Virginia can continue to offer essential services and begin to recover from the economic devastation of the pandemic. Through the work of the Back to Work Task Force, we've learned that we all have a huge responsibility to support the health and stability of the child care industry. We need to figure out how to ensure that Virginia is financing a child care system that allows small businesses like yours to operate safely, effectively, and affordably, so parents can be comfortable with returning to work, providing for their families, and getting our economy moving again. We recognize that child care is and will always be a vital part of our infrastructure, just like transportation and electricity. It keeps our economy and our lives running. We must support and fund child care like the critical and essential service that it is. This requires all of us to work together. It requires Virginia's public officials, like those you will hear from today, including Duke and Jenna, to share the ways they have been and will be supporting your continued stability. It requires input from private sector leaders, like those today who will share innovative ideas to strengthen your small businesses. It requires employers, education and municipal leaders, and nonprofits like Smart Beginnings and United Way, all working together for families. And to be successful in reimagining our system of childcare, it requires you, the heroes and sheroes of the childcare industry, to be ready to make the shifts and take the steps to ensure equitable and affordable access to quality childcare for all Virginia's children. I speak today not only as co-chair of the Back to Work Task Force, but also as a grandfather of 9 when I say thank you, each and every one of you, for what you do to support our families and our young children. And thank you for engaging with us to ensure that your essential services can be available, affordable, and accessible to all Virginia's families and their young children. With your full support and our full support of you, we can surely give our young children the chance they deserve to be the best they can be and to fulfill their full potential. So thank you for taking time to be here. Thank you once again for your service. And take it from this grandfather, the service that you provide is absolutely critical for our young kids. And I couldn't be prouder of the work that you're doing and what I know you will do going forward as we put in place a child care system that supports your industry to the best of our ability. Virginia cannot afford to do anything less. Thank you, and I look forward to your discussion today.
Thank you, Jim. This is Kathy Glazer with the Virginia Early Childhood Foundation, and what a great rousing way to start our conversation today. We couldn't think of anybody better to get us started. And Jim, thank you so much for your heartfelt and authentic message. Next, we're really excited to welcome Commissioner Duke Storen of the Virginia Department of Social Services, and really pleased to have a chance to hear from Duke today about some of the efforts that the Department of Social Services has been doing and plans to do in support of the child care industry and particularly for the home-based segment of that industry. Duke, welcome.
Well, thank you, Kathy, and thank you, Jim, and good afternoon to all of you. Really appreciate the opportunity to provide a couple comments today to you who I consider as, true heroes of the pandemic. While I'll give you some updates and provide you some information, the one takeaway I want you to hear from me today is just a thank you. Thank you for staying open. Thank you for being essential. Thank you for providing this valuable, indispensable service. And thank you for caring for and loving our children across the Commonwealth. It's been quite a year, and I and really all Virginians are in awe of your continued resilience and capacity to serve our families and children. I know that many of you are licensed family child day providers and that you interact with members of my team in that capacity. And I also know that some of you provide services informally as families and friends and neighbors. Those services are incredibly valuable and important. So no matter what your format or your program type, you are essential, and we are grateful. I think, really we've seen that many families today are preferring home-based settings for their children because of the fear of the pandemic and because of the amazing quality and reputation that home-based settings enjoy in Virginia. And now more than ever, I think your services are a true lifeline for so many families. My team and I at the Department of Social Services, we have tried our best and we have worked hard to figure out the ways to support small businesses and programs like yours, to support vulnerable families so they can access safe, quality childcare that they need, and so that they can go to work. We've tried to think about training and education and providing the sort of guidance and access to materials that we hope that you've been able to take advantage of to stay open safely. So while 2020 has brought us significant crisis, we also see a great opportunity in that Virginians are now more in tune with our responsibility of ensuring the stability and health of an essential childcare industry, and in particular, the home-based sector. So some of the things that we've done, we've provided guidance to help providers with the information to continue to operate safely, to comply with regulations, mandates, guidelines, whether they come from the governor through an executive order, they come from the Department of Health, they come from the Department of Labor, they come from the Centers for Disease Control. There's a lot of information sort of coming at you, and I'm hoping that we're able to sort of package that in a consolidated way so that you have the latest information. We've also been fortunate to be able to provide stabilization grants, and we've also been able to increase the rates of reimbursement for home-based childcare, both licensed and unlicensed care of those who are taking the child care subsidy. We plan to continue this funding, so we're going to do another round of those CARES Act stabilization grants coming out, and we'll be communicating about that probably on Monday. And we also are hoping to provide some support for you through subscriptions to technology and automation and connection to quality supports, really through our Smart Beginning coalitions and BECF. And then starting this month, we will be sending out some PPE to all child care providers directly throughout the Commonwealth. And I just, really want to say how pleased we are to work with Kathy and the terrific team at the Virginia Early Childhood Foundation and our other partners like Child Care Aware Virginia and through BECF, all the Smart Beginnings coalitions. We're testing new innovations. We are putting, funding out to keep the industry financially viable. And we are here to listen to you and learn from you. And, our job is to help you do your job. So please keep providing us feedback. Contact your regional licensing office. Contact us directly at the department. Work through those Smart Beginnings coalitions and provide us the information and feedback that we need to best support you. Later today, you're going to hear about the Ready Network, which is a partnership with Wonder School. And we believe that that can really inject some important business supports to help connect you to the quality supports that you need to remain viable and to thrive. We really think this is a practical way to ensure that the investments we make in your programs will endure so that families and young children can continue to benefit from your services. But once again, my most important message is just a heartfelt, sincere thanks to each of you for being true heroes of the pandemic. Thank you for what you do every day in caring for Virginia's children and providing important services to our families. And with that, I'm going to turn it back over to Kathy. Thank you.
Thank you, Duke, so much. Really appreciate that. And would you be willing to hear a question or two?
Of course. Yes. Thank you.
Thank you. First of all, let me share with you a couple of comments. Thank you for all the support that has been given so far. Thank you so much. We do need a lot of support right now. And one proud provider said, "We never closed." And I think that sort of says it all. One question for you is, can you tell us a little bit more about the rate increase for us home providers?
Yes, so we increased the subsidy reimbursement rate. So for those providers that participate in the child care subsidy program, we increased the rate of pay, rate of reimbursement for them. I'll have to, while we're on this call, I'll go back and look at the exact sort of percentage increase, or unless Jenna knows it off the top of her head, but we did increase that, and our plan is to have that rate increase in place for a minimum of 2 years as we sort of manage through the pandemic. And then, of course, we hope that we'll be able to identify the funding to make that a permanent rate increase over time. But it's going to be in place at a minimum for 2 years. Thank you.
Excellent. Let's see. Rate increase, do you know yet when it will take place, or is that a stay tuned?
It's already in effect. Yep.
Excellent. Thank you so much, Duke. I really appreciate it. And again, just seeing a lot of gratitude in the question box and in the comments, and just a reminder of how much this sector needs support right now, especially because there is so much additional demand being placed on them. So much appreciated. And Duke, you're welcome to stick with us if you wish and can. I know that you likely have to jump off before long, but we're grateful now to welcome Jenna Conway, the Chief School Readiness Officer for the state and with the Department of Education, and looking forward to hearing her comments about how that agency is also supporting this workforce.
Excellent. Thank you, Kathy. It's a hard act to follow in terms of Mr. Dyke and Commissioner Storn, but also very excited to have the opportunity to speak to so many of you. I know how difficult it is to get off the floor, or and to be able to jump on this call. And so imagine it's potentially during nap time, and you're able to come off and hear from us. I too wanted to express my appreciation on behalf of the Department of Education and the Office of the First Lady Pamela Northam, for all of the work that you all have done over the course of this pandemic. You are truly the sheroes, and she recognizes this. This First Lady, I think, is the first one who's been able, as part of her annual back to school and child care tours, to visit Family Day homes. I know we, from the southwest of the country through Tidewater, have been able to visit Family Day homes who have been open and operational throughout this pandemic. This year, she's been delivering not only books, but personal protective equipment. And as Commissioner Storn noted, there's more of that to come, which is just a sign of the times, and recognizing how incredibly difficult it is to stay open and operational, as many of you have throughout the course of this pandemic, right? Most of you have, right? 4 out of 5 of you have stayed open day in and day out across the community, serving as a lifeline to your families. What I wanted to do is to sort of recognize 2 things this afternoon. One is to note how we work very closely, the Department of Education, the governor's office, with social services to make sure that we're able to serve you all throughout this pandemic. And Commissioner Storin went through the details of some of the things like the direct cash assistance, increasing the rate, the personal protective equipment, in recognition of the kind of need that we've heard from the community. I wanted, on behalf of the Department of Education, to note that we hear this, we recognize this, we've been a part of this, and some of this, as many of you know, that oversight for childcare is transitioning from the Department of Social Services to the Department of Education next year. And so wanted you to feel confident that we will continue to make sure that you all are recognized, that we talk about the incredible work that you do, that you know that we see you as part of the puzzle in terms of a really important piece of how families of children, from infants and toddlers to 3 and 4-year-olds, are really a critical part of the care and education that children receive prior to kindergarten. And even though supporting Family Day homes will be new for the Department of Education, we want you to know how critically important we see you. We are moving the parts of government that oversee childcare to the Department of Education. We started this work this summer in response to a state law that was passed, and licensing and oversight for the childcare subsidy program will move on July 1st of next year. We want you to know that we see you all as professionals and as educators, and I think that's really, really important. We typically work with educators in schools, but this is a really exciting step forward for us to be working with educators in childcare centers and educators in family childcare, as you all are. And I think that's really important to note. We don't care the name on the outside of the building. We don't care the building type. We don't care the funding source. We see all of you as really important early childhood educators, and it's our responsibility as this moves to the Department of Education to support all of you. We see you as quality. And we know how passionate you are about childcare and improving how you operate. It's so exciting to hear the innovations, as Commissioner Storin noted, working very closely with the Early Childhood Foundation and Wonder School and Smart Beginnings to innovate some of your practices. And we know, as I've heard directly from many of you across the state, how much you care about kids and want to be better every day. And you're just sort of sponges for what can I do differently? How can I improve? And we want to know that all of that will be recognized. Some people have asked us, well, when you move to the Department of Education, will we be required to have a bachelor's degree to be an educator? Absolutely not. We see you as educators currently. You do not need a certain degree to be considered an important early childhood educator in our eyes, and want to make sure you hear that from the Department of Education directly. We also know you need additional funding to increase access. And I know, as Commissioner Storin noted, we have put in place a rate increase. We know that you are still struggling. Your enrollment is lower than usual, and I know it's hard. Your costs are higher, right? More supplies, more cleaning equipment, more things are needed, and you're at an all-time high level in terms of stress. We've looked at surveys done by the University of Virginia, and we know that you're on the front line and you're facing incredible stresses, and we will continue to work social services, education, and the governor's office to get every possible federal and state resource to you as quickly as we possibly can, because we know it's so hard to operate right now. We also know that you truly represent your community, and I think it's important to note this. We will, as we move everything to the Department of Education, we have a lot of different types of providers. We also have really unique communities across the Commonwealth. We know that you are more likely to look like your community. Not only are you located and closer to your kids and families, but you're more likely to look like them. You're more likely to speak their language. And as Commissioner Storin and Mr. Dyke noted, many families would prefer you, particularly for our babies and toddlers, and really making sure that we recognize that as we think about how we can work together to improve quality across the board, across our family childcare homes, across Head Start, across our childcare centers, and across our schools. And we really have to work together. There's not a single one of us in any community in Virginia or across the state that can do this all alone. We need everybody to come together to help prepare more kids for kindergarten. And we want you to know that we really see you as an important part of that. And I wanted to let everybody know that we are creating a new early childhood advisory committee to the Board of Education. We have special slots for family child care on this. We will make sure to get we've just posted an application and they're due back December 18th, and really encouraging folks, if you'd like to help us think about shaping policy, putting in place rules and regulations and practices and making sure that family child care is included, we invite you to apply. And I'll make sure to share with Kathy and the team the link. So if you want to get the application, it's a brief application. It's not too tough. If there's any language concerns, we can help with that. But we really want to make sure that we have family child care at the table. Not only do we see you all as professional educators, but we want to see you as partners and helping us shape policy to make sure that we include you as we think about how to do this well, that you're not an afterthought, but that you're at the table shaping the decisions. And so we'll get information out for there, but we are excited to welcome you at the Department of Education. We see you as educators. We need to have at least a few of you apply to be represented on our advisory committee. And we will continue to work closely with the governor's office, Department of Social Services, to support you to recover from the pandemic and then to be a part of the education team after July 1st of next year. Kathy, let me pause there and see if there's any questions.
Thanks, Jen. I appreciate that. There are a couple of questions. Some are likely for you and some may be for Duke. This one is for you. In terms of the advisory board, how do they access an application?
Sure. We have a on our website, and we can potentially send that around to everybody who's on today.
Perfect. Thank you. There was a comment, please keep home daycare and educators as essential personnel on the front lines for getting tested and then vaccinated. So just a comment and a wish for support of them as far as, them being essential workers themselves.
Absolutely, that's really important. Those conversations are happening now, Kathy, and that's a really important point in terms of the vaccinations and prioritizing those, like our family child care home educators who are on the front lines and are certainly essential.
Yeah, thank you. This is a question about the differential rate. One individual says that we have quality programs and the pay rate between center and family programs is still a big gap. This was present even before the pandemic. Just wanted to check and see if you all want to respond to that, either of you.
So I think that's a really important point. One of the things that this Early Childhood Advisory Committee will look at, and that certainly the Department of Education will look at, is what are health, safety, and quality expectations, and how do we align funding for that? As Commissioner Storer might want to speak to, but what the federal government tells us is set the rates based on the market. And the challenge, as you all know, is you often set, the market rates are based on what families can pay, not on what it actually costs to meet the health, safety, and quality expectations. And so in the move over, we will look side by side, center, home, school-based, look at what the expectations are from the state, and then consider different ways of funding you to be able to address those. So most immediately, Commissioner Storer noted the rate, and that's sort of a step towards more equitable funding. There's more work to come, and we plan on doing this when this moves over to the Department of Education.
Perfect.
Yeah, just to add to that, the rate is based on the market, and that's sort of a federal policy. That said, we have looked at how we tie a bonus payment or a rate increase based on quality, and I think that's what Jenna's talking about. So that's sort of more to come there based on the input from you and other providers, but I do think there's an opportunity to continue to strengthen the reimbursement rate, even given the federal regulations.
Thank you. And Duke, just the folks would like to hear one more time about expectations about timing for the next round of CARES grants.
I anticipate that we are aiming to make our announcements on Monday about the next round of CARES grants, and our intention is to make it very easy for those that have already participated in CARES grant to receive an additional 3-month payment, and to really focus on underserved communities, and try to really incent those that haven't participated before or have been closed to reopen to increase capacity. So I think I anticipate being able to have that information out in the public on Monday. Thanks.
Excellent. Thank you. I know I promised both of you I'd let you off the hook because you have 1 o'clock commitments. And so I want to live into that, but can't thank you enough for spending some time with us. You both have worked tirelessly, as have your teams, to make all of this work. So really appreciate your being with us today and for sharing this information. And we'll wait on the edge of our seats for additional information. Best of luck to each of you. Thank you.
Thank you. Thank you so much.
All right. Take care.
Thanks, Kathy. And thank you, everybody. Take care.
Thanks so much, Commissioner. Now it is my pleasure to introduce our next speaker, and so pleased to welcome Natalie Renew, who is the Director of Homegrown, which is a national initiative that's committed to improving the quality of and access to home-based childcare. She is an early childhood professional, and she has more than 15 years of experience in the nonprofit and social service sector, supporting children and families who are most vulnerable. Prior to joining that organization, Natalie led the expansion of the Early Childhood Education Group at Public Health Management Corporation in Philadelphia. She has overseen the development of large programs, secured sustaining funding for major initiatives, and has supported local systems change in the early learning sector. Earliest in her career, she worked in child welfare and food access, and I'm just so pleased to call her a friend and a colleague, and just grateful for her vision and leadership, especially around the home-based industry, and know that you'll look forward and benefit from hearing from her today and the encouragement that she brings to you as well. So Natalie, welcome, and we look forward to hearing from you.
Thank you so much, Kathy. It's really a great pleasure to be with you all today, and with all of the providers, and with Jenna and Duke and Jim. I'm really pleased to join you all. So what I'd like to do today is share a little bit of sort of the national landscape of what's going on with home-based childcare, to talk a little bit about the context, the moment in which we find ourselves, and why I think it's a particularly good time to make some big changes on behalf of home-based care, and then to sort of share a vision and talk about the role of networks to support home-based childcare providers and how we've been thinking about that work across the country. So I have a few slides that I'm going to share and kind of talk through, and really look forward to also answering questions and engaging in this conversation. So as Kathy mentioned, we're a funders collaborative. We started with 10 and are now 12 national funders who really came together to say, let's prioritize home-based childcare, recognizing that investment, innovation, research, and attention on home-based childcare was not what it should be, and that there was really an opportunity to do much, much more. When we're thinking about quality and access, we really are prioritizing both licensed family child care providers and regulation exempt or unregulated family friend and neighbor, and see this broad and diverse continuum of providers across the country that we want to support. We are very new. We just started last year, and really have shifted a lot in response to COVID-19. And I'm going to talk a little bit about some of the work we've done during COVID, but have had to make significant changes in terms of addressing the needs as they emerged during the pandemic. And then here's our website. We'd love for you all to become engaged with us and join on our website and get our materials and share your experiences with us as well. So I'm going to now shift to the next slides, maybe 2 forward, to start talking a little bit about the national landscape as it relates to home-based care and some of the kind of key trends and issues that we're seeing around the country. So sort of prior to COVID, we knew that the largest number of young children and nearly half of all children who are in care are having their early childhood experiences in home-based childcare, nearly 7 million children. That number has probably changed some during the pandemic, but it's really a significant portion of young children who are in care. And that most of that is actually happening in, family, friend, and neighbor care in unlicensed, unregulated settings. And so really, we've seen so much innovation and so much support in school and center-based care, yet so many of our young children are having their early childhood experiences in these settings. And disproportionately, children and families that we care a lot about are in these settings. So children from low income, children of color, infants and toddlers, children in rural areas, children with special needs, and those whose parents work non-traditional hours. So really want to frame the conversation just around the significant number of children who have their early childhood experiences in home-based care, and that these are children and families who, we care a lot about. If we can go to the next slide. We've talked a little bit about this, and I think there are a few different reasons why families are choosing home-based care that have been mentioned on the call, but I will just sort of underscore what we see as some of the key assets of home-based care and why families continue to choose this setting. Number one, and I think most importantly, are the trusting relationships with providers. Family childcare, home-based childcare is hyper local, and often caregivers have longstanding relationships with families that really build a base of trust. There's often shared culture, values, language, and child rearing practices between the family and their care provider. Again, this kind of accessibility, very neighborhood-based. So, for families that may struggle with transportation or things like that, there's, high degree of accessibility. Small group sizes, by its very nature, this is a small and stable group with typically 1 or 2 caregivers. And that's something that I think, particularly in COVID times, has become really relevant and important feature to discuss. The opportunity for young children to be served with their siblings and to be served by the same caregiver over time in this mixed age group setting is really a value to families, and increasingly the science really endorses that this is a positive learning experience. Again, sort of the intimacy and the family supports in the home are an appeal to families. Accommodations for non-traditional hours and cost-effective care are also 2 key reasons that families continue to choose home-based childcare. And what I would say from our perspective is that these are, in some cases, inherent by the very nature, the assets of home-based care. And this is sort of this incredibly strong, vibrant foundation of care that we need to build on and ensure that we sort of maintain, recognize, and support as a key feature of home-based childcare. We can move to the next slide and talk a little bit about what we've seen across the country for family childcare providers during COVID. This really is resonant with a lot of the conversation that's already happened, and I'm so heartened to see how the state is really responding to some of these key challenges that providers are facing. The health concerns just continue to be really significant, and again, children are coming into your homes, and so, there is a risk not only to operators, but to their own families, and we know that providers are really concerned about the health and well-being of the children and families that they serve. The financial hardships, and that really, relates a lot to food and housing insecurity. As a part of our work, we've supported emergency funding for home-based providers in 13 communities across the country, and have really seen this dynamic play out where enrollment has changed, providers continue to be open, so, operating with less revenue, with increased expenses related to sanitation and PPE, and really with limited access to public supports. So it sounds like, the state of Virginia is doing a lot to address that, but, we have really been tracking through the success of providers in gaining access to partial unemployment, to the PPP, small business loans, to hazard pay and things like that in states. And it's been a real challenge for providers to gain access. So we know that despite being critical to, essential workers and to families right now, and really offering key assets that families need so much right now, small group size, strong relationships that build family resiliency, we also know that providers are having a hard time. We can go to the next couple of slides here. So really sort of want to talk a little bit about kind of the moment that we're in. The backdrop is really some of these hardships that providers are experiencing. Home-based childcare disproportionately continued to operate throughout the pandemic. And even now, we're sort of seeing that while many other settings have reopened, enrollment is higher in home-based childcare. And really, parent demand is shifting. So both this increasing reliance but increasing preference for home-based childcare. And I'm going to talk a little bit more about that, but also some other opportunities and issues that we're seeing in the context. We're seeing a lot of signaling from the federal government, both legislative and administrative, interest around home-based care. We're seeing cities and states that are really saying, like, we see you, just as your state administrators have said, we see you, really stepping up for families and essential workers right now, and we know we need to do more. There's also been a lot of coverage in, the press and additional, this recognition that maybe hadn't been there before. I think I would also say the reckoning around race that's happening in our country really means that as a field of early childhood, we need to think about the role of home-based care that has often been under-resourced and under-recognized even within our field and in society at large, and that there's a lot of work to do to address that as well. And then moving to the next slide, I wanted to just share a little bit more detail of what we're seeing around the country around parent demand. So, we conducted some surveys where we really found that, when that lots of children are staying home with their parents, when the parents are working outside of the home, they're primarily relying on family, friend, and neighbor providers, and that even among formalized family child care, there's increasing reliance and increasing preference for this care type. And again, seeing sort of increasing use of relative care, decreasing use of center-based care. And I offer this information. I think this issue around parent demand is very dynamic, and we don't know if this is a long-term or a short-term issue, but I do think it's really critical, in terms of contextualizing the data I shared right up front, which is that most really young children are having their early childhood experiences in home-based childcare. And we now see this data emerging around both reliance and preference. It's really critical. So with that in mind, I want to just offer some thoughts on sort of like moving forward, thinking about both the incredible hardship that providers and families are experiencing right now, but also some of these opportunities in terms of narrative shifting and recognition and where we go from here. So we can advance the next couple of slides to talk about kind of a vision. Our vision, and we hope your vision, is really a future where home-based providers are well-resourced to deliver high-quality services for children and families, and that home-based care is really seen as that critical asset to children, to families, to communities, and that the needs of providers are prioritized within the sector and society at large. And we really sort of see a few ways forward in that, so we can go to the next slide, and I'll share sort of the issues and investments that we are trying to really elevate as a part of that conversation to get to that place. And one is really sort of this acknowledgement and deep investment in this broad mixed delivery system. And I really just loved how, Jenna shared this. We see you as professionals and educators and critical component of this work. That message of inclusion and recognizing that families need different things and we need a diverse mixed delivery system that's well supported to get us there is really critical. Making emergency funding available is going to be critical to preserve supply and make sure that the providers who are so committed and are here right now are able to see through this crisis. And then really, you know, as we move forward and think about building back, there has to be greater investment in the sector to increase access for families, but also to improve payments and compensation for providers. We just simply have to get more money in the system and ensure that providers are adequately compensated. And then lastly, we really see an opportunity to build more durable system infrastructure to meet the needs of providers and see networks as a way to do that. From our perspective, networks are really well positioned to deliver quality support, to streamline business activities and maximize revenue, and then to systematically connect families and providers to comprehensive services, health, mental health, disability services. And in order to do that, there's really sort of our thinking is that networks need to be co-designed and developed alongside with families and providers. We need to build the capacity of the organizations that serve in those roles and ensure they have what they need. And we need to use effective tools and research-informed programs, which, you know, I can already hear in your model you're doing with bringing on partners like Wonder School and others who have tools that have been demonstrated to be successful. And then we also need to think about what are the policies and public financing that get us to do that. Again, this concept of network is really flexible and it needs to be driven by community design, locally adapted. And I'll just add in closing sort of why we are so excited about the concept of networks is that, you know, there's really this opportunity for both efficiency. So why should each provider have to figure out and solve the same problem individually? How do we solve problems kind of at this efficient level? But also the opportunity for specialization, right? What might it look like to have nested within a network some really specialized accounting skills or technology skills or, you know, nursing skills, right? Those are a level of specialization that individual providers cannot afford or manage themselves that could be made available at the network level, and we think that's so critical. Another piece that's really exciting about the concept of networks is that we can pull up lots of data and information from lots of providers and really refine supports and learn and improve together to make sure that the professional development supports, the business supports are highly attuned to the needs of providers. And you know, also think about ways to offload responsibility so that providers can spend more time doing the things that are most important to children and families, building those strong relationships, learning and supporting children in that setting. And I see I'm going a little bit over time here, so I'll just finish with this last thought and then, you know, happy to follow up in the questions. But from our perspective, there's sort of this nesting doll of impact, right? So right in the middle of that concept is children and their families. And then providers come around that and really enable the success of children and families with quality services, you know, that help families accomplish what they need to accomplish. Around providers, we hope to see networks that are really helping providers meet their goals and help them accomplish what they need to accomplish. And that around those networks are these responsive public systems, and that there is this bi-directional relationship where providers, networks, and systems are sharing data, are learning from each other, are pulling down resources and supports in ways that assure that children and families thrive, that providers are supported and compensated and thrive, and run effective businesses. And that those public systems are able to get resources to families and providers, but are also able to learn and to refine how they better support providers and families. So with that, I'm going to stop there, but really excited to join in the Q&A and conversation and share, you know, and answer any questions.
Natalie, thank you so much. What a great big body of information and learning that you've shared with us. I wonder if you could just expand a little bit on one area that you touched on and that you and I have talked about before, We are, excited to be rolling out a staff network, and sort of, there has been some experience in Virginia around this, and now we're really thinking about sort of what the next generation of that looks like, and this partnership with Wonder School. But I think that it would be helpful to also understand that, especially from the work of the Back to Work Task Force that Jim referenced at the start, there are ways that the not only the state, but the business and employer community also will benefit from having a structure in place where they can draw from and count on the home-based sector in more efficient ways. And so can you talk a little bit about sort of that aspect of staff networks?
Absolutely. And, I think, again, in this concept of kind of those layered supports, what I see networks as being able to do, staff, family, childcare networks being able to do, is to really sort of connect providers to partners, funders, and policy, and to create a little bit of an intermediary and a way to do that at scale, right? So that individual providers do not have to build relationships with every single employer, do not have to have, memoranda of understanding with different institutions like disabilities institutions and mental and health institutions. But networks can really broker those relationships at scale. And, what enables that is data, right? So having data in a data system so that, the network can really be saying to providers, in our network, we have 100 open slots for your employees' children, right? We have available supply. But it can also expand beyond that, right? The network can say, based on what we are learning and hearing from providers, we need more professional development around this topic, around this issue. So it really creates this a scaled way to see need, to see success, right? So we can learn about what's really working well across a large group of providers. And it can do that in a way that is supportive of providers. Again, we know that home-based providers are typically working over 50 hours a week directly serving families. In addition to that, they have to do all their administrative work, all their business work. They have to shop for food. They have to clean and sanitize, right? So the idea that any one provider can build those type of relationships individually, I know it's possible because providers amaze me every day what you all accomplish. But to have networks help really streamline those relationships and connections to sort of help interpret policy and to think about how to bring new opportunities is really, to me, the magic of what a network can do, is really facilitate much broader and more impactful relationships between providers and employers and systems and policymakers.
Yeah, thank you, Natalie. I appreciate that. And I know that, one thing that we've seen, especially in the, since the late summer, when so many of our school divisions, shifted to a virtual format, we were learning from employers in particular that in some ways they're so used to being able to tap into providers and sort of one-stop opportunities for school divisions to have sort of before and after school care and sort of have their one and done sort of contact. And in this era where more and more working families are really, trying to find in-person care and in smaller settings, this is in some ways a structure that helps connect the supply with the demand. And so because often, family, friend, and neighbor, or, it really any childcare program is fairly independently run, and all of that is important. And, there's a lot of richness and advantage to that too. But to have some kind of a way of connecting more so that it's easier to really figure out how to make that match. Our friends with Child Care Aware are on the line today and have been terrific partners in trying to kind of make those matches work. And we're thinking that this kind of a staffed childcare structure and sort of the technology platform of Wonder School will facilitate even further being able to connect ready supply with the demand that is very much there. We've had a couple of questions and comments from our attendees today about their frustration when they're open and operating and can't fill their slots. And so that's just sort of a very immediate and practical example of how the connector of a network could make that more, could facilitate solutions.
Yeah, and again, I would say this is enrollment, or it is one of these issues where we see direct benefit at all levels, right? So for the family, this cuts down on their time to find open slots. It helps them really get to a provider that they want to use much quicker, and they use far fewer resources to do that. So there's a direct benefit to families. To the provider, it increases their enrollment and it stabilizes their enrollment. So having that additional support to ensure that you are fully enrolled, or as close to fully enrolled as you can be over the long haul, means that your finances are being stabilized, and that you can start to really be more predictive in terms of how you're thinking about your finances without that drastic up and down and changing of enrollment, which in a family childcare home, the shift of one child is a drastic change in your enrollment, right? That could be 15, 20% of your enrollment. So, that really helps stabilize your finances over the long haul. But then to the childcare aware, entities and agencies and the system partners, to have that knowledge and understanding of where gaps in supply and demand are, and to be able to assure that at that system level, at that network level, what that data look like is so critically important to help target where resources go and to think about how to deal with gaps. So, I think enrollment is such a great example of how families benefit from the participation in systems like this, how providers benefit, and how system actors also benefit. I think it's a great example, Kathy.
Thank you. And we have one of our rockstar providers has put a comment in the question box that I think is so astute and just so relevant to this conversation. An ideal support model needs to include the provider, parents, businesses, government, service provider, and the end users benefiting from the service. And this is separate from the children's early learning. So, this is kind of the business side of this kind of a structure, and is a different aspect from the actual services provided and the quality of the care for the children. So thank you, Natalie. If you will stick with us, we're going to move on, but I'm sure there'll be some more questions that we want to engage you with. So thank you for sharing that information. Much appreciated. And now we're going to keep our fingers crossed and hope that through the wonder of technology, we're going to be able to show a brief video to introduce the concept of this Ready Network, which was just recently launched in Virginia. We just have a few sites so far that have launched. We've got some of the folks on the webinar today who've been instrumental in getting this off the ground in 3 areas of the state, and are really interested and excited to share this information with providers today. And if you're interested in learning more, we're going to give you some information about how to speak up and express that interest. But let's see if we can view this video. Drum roll, please.
Welcome to a webinar on Ready Network. Our focus today is to give a big picture overview of what Ready Network is and the motivation behind it. I'm Morgan Yonke with Virginia Early Childhood Foundation, and I coordinate with our Smart Beginnings partners, Wonder School, and other key partners on Ready Network implementation. Today's information session will cover 3 items. First, the big picture. What is Ready Network? Then we'll provide a demonstration of the Wonder School platform to give you a sense of how the technology works. And we'll end with who to contact to learn more about next steps or get more information. The pandemic has resulted in an evolving early childhood landscape and changes in family childcare needs and preferences. As part of Virginia's exploration of strategies to build capacity of the childcare industry to meet families' needs for affordable, quality, safe childcare, Ready Network was created. Ready Network is a staffed childcare network that offers providers access to a network of supports tailored for home-based and small center-based programs to ensure they have what they need as families' demand for care and education services in smaller settings grows. Ready Network was launched in Hampton Roads, Greater Richmond, and Southwest Virginia in fall of 2020. Regional hubs, Wonder School, and the Virginia Early Childhood Foundation are partnering together to provide childcare providers with resources and the technology needed for a thriving business offering high-quality care and education to children and families through Ready Network. Regional hubs are the primary contact for providers. They're responsible for enrolling providers in Ready Network and making connections to professional development resources and supports. Wonder School provides training to providers on how to get the most out of their technology platform to simplify the day-to-day administrative tasks needed to run a program. And Wonder School also provides ongoing customer support for providers and parents who use the platform. Finally, Virginia Early Childhood Foundation serves as the coordinator across all partners to build a strong, sustainable model. We have secured funds to cover the cost of a one-year subscription to Wonder School as an incentive for the first childcare providers willing to join Virginia's Ready Network. Similar to most grant-funded efforts, we can't guarantee all of these benefits offered through Ready Network in this first year will continue to be free. However, we can guarantee that Ready Network is being built to bolster the childcare sector. We're asking providers who join Ready Network to give their input and expertise so we can make improvements to the network and have a better understanding of the value of the services available. Now that we've covered what Ready Network is and who is involved, I'm going to share two short videos with you. The first is a 3-minute demonstration of the Wonder School platform. And here we go.
Hi everyone, thanks for tuning into this video about the Wonder School platform. My name is Tess and I run the onboarding process for providers who have joined Wonder School. As a little bit of background, the Wonder School product was built to support the unique challenges of running a family childcare business and has also been built out to support childcare centers. Using Wonder School strengthens childcare providers by bringing them the tools to address common challenges with running their business. We help provide a professional website, program marketing, streamlined processes for touring and enrollment, tuition management, and maximizing financial stability and growth for the program. We help enhance parent communication and connect providers with a broader community of providers all across the country. It sounds like a lot, but we've built the Wonder School platform to be very user-friendly and easy for parents, providers, and supporting childcare networks. Let's take a look. By heading to wonderschool.com, parents are able to easily search for childcare programs, micro schools, or nannies located near them based on their zip code, city, or state. Parents are able to use the search filters at the top to narrow down what they are looking for and compare programs to find the best fit for their family. By clicking on a Wonder School website, families can read about the childcare, book a tour, or message the staff to ask for more information all in one place. On the childcare provider side, providers are able to use the Wonder School platform to easily manage administrative tasks it takes to run their program. They can keep track of all of their enrollments and the state of capacity of their program. They can view individual student profiles to securely view contact information, child-specific medical information, enrollment documents, and a running record of all the payments the family has made in the past to the program. Using Wonder School, providers are able to easily bill their families online without having to worry about going to the bank to cash checks or collect payments through multiple systems for multiple families. They can create payments, or they can set up automatic billing schedules for both private paying and subsidized families, as seen in the student's profile. They can keep track of their business's financial health and ensure they know when the charges will be made and deposited into their account. In addition to the enrollment management and payment system, providers can also keep a running record of families that have expressed interest in their program in the past. They can also maintain a wait list through the platform. For families who have ever sent a message or toured the program, the platform stores those families' information so providers can reach back out to them when available spots open up. Providers are able to easily build a strong pipeline for their program and decrease the time it would take to normally fill those spots. WonderSchool also sets up providers to be able to easily market their program online. With a fully customizable website, providers can easily input information, update photos, and update anything regarding their program's prices or any other information at any time. They can use the platform to find local marketing groups to post in, parent groups, community groups, etc. in their area to post their website and share their program's information to increase their search engine optimization. Curriculum ideas, professional development sessions, and many other resources are available to providers from our education team. Our Curriculum Corner offers ideas of daily activities for providers to be inspired by. There's also recorded trainings that we offer for providers to be able to access. And we also have our community Slack group for all providers to be able to share ideas, advice with one another, along with attending weekly webinars to learn from each other's experiences. We look forward to supporting your program and showing you all that WonderSchool has to offer. Thanks so much for watching. If you have any questions, please feel free to reach out to our team at hello@wonderschool.com. Thanks a lot.
Okay, now that you've got a little bit of a sense of what the WonderSchool platform can offer, I just want to share a brief testimonial from a provider who has used the technology.
Prior to me opening my own school, I was a social worker. My heart has always been to work with children and help them reach their full potential. So that's definitely where I kind of had, there's a connection between social work as well as education. One day when I was just kind of surfing the internet, I found WonderSchool, and I found this organization who was helping people like myself want to open up a school of their own, help them, and then they gave you lots of resources and connected you to services and walked you through the process. I have this home, but I didn't know how to create this home into an actual school. So by talking to them and connecting with their specialists, they kind of given me some tips and ideas to use throughout my house. They helped me set prices as well as just help me make myself marketable and competitive within our area. I am taking kids that are on different types of subsidies programs or child care voucher programs. By taking these kids who are maybe underserved, underprivileged, maybe don't have all the resources, all the benefits of a cash paying parent and being able to afford a quality program, I'm actually giving a child who more than likely would not have the opportunity to be a part of a high quality program a chance to get a high quality education. Which plants are we going to water? All of them?
Now that you have a sense of what Ready Network is and how the WonderSchool platform works, want to make sure you have some contact information. So if you're ready to sign up or you want to connect with your regional hub, you can see their information right here. So in Greater Richmond, you would contact Dorothy Billups at dbillups@childsavers.org. In Hampton Roads, if you're in the peninsula, you would contact Nancy Null at nnull@smartbeginningsvp.org. Or if you're in Southampton Roads, you would contact Chris Miller at cmiller@smartbeginningsvp.org. And in Southwest Virginia, you would contact Susan Patrick at spatrick@unitedwayswva.org. I just want to thank you all for taking the time to listen to this webinar. If you'd like more information, you're always welcome to reach out to me directly at morgan@vecf.org.
Thank you so much. And that was a recording of Morgan, but she's also on the line and can be part of the conversation now, following that recording. Just really appreciate the chance to introduce this concept to you all. We are, launched in those 3 areas. And so if you have an interest and want to learn more, please reach out to any of those contacts, or probably the simplest way to remember is info@vecf.org to express your interest. We also have some ideas in mind for launching in other areas of the state and for figuring out how to make the initial participation for at least the first year be free of charge for those providers who are interested in testing it out. I think that as we go along, we'd just be interested to see any questions that you may have in the question box. I think that some of you seem to have some audio trouble with hearing the video. We are sorry to hear that. We will be sending a recording of this full session out to the attendees following this. So you'll get the slides and be able to access the video and all of the recording of the information in the conversation. I think if I am able, I'm going to ask Morgan to unmute. I'd love to invite Cheryl Moorman to jump in and bring some comments or any questions or thoughts that she has. Cheryl is the head of the Family Child Care Association in Virginia and has been a terrific friend and colleague in thinking through some of these strategies and thinking about what is good for this sector of the childcare industry. And Cheryl, if you're unmuted and can speak, we'd love to hear from you.
Good afternoon. Can you hear me okay?
Yes, we can. Thanks,
Okay,
Cheryl.
awesome. Good afternoon, Kathy and Morgan and others that are on the call. Again, my name is Cheryl Moorman, and I, as a family child care provider myself, I first want to say thank you for all the support that you have given to in-home providers during this pandemic. I truly hope that it's a start to a lifelong relationship that has happened, that just happened to have been birthed out of the pandemic. I know that we are a very unique field and we do not fit the average mold. However, we are an option that is available for families in our community, not less than any other option that may be available, but equal to. We've been a second thought in the child care sector for a long time, and it's really refreshing to be recognized as the quality program that we have always strived to be. So we do understand, as a side note, that the subsidy rate increase is based on the reasonable and customary amount. But in consideration of the increase that was alluded to earlier, we just want to remind you that the same children that are in a daycare center setting is the same children that is in a family day home environment. And we're not asking for anything different, just to be equal to or close to being equal to. So I am excited about the advisory board being open for family child care providers. It is important that we have a voice at the table before plans are put into place. So this is a great opportunity for that to happen. So thank you for setting a place at the table for family child care providers. I have my own reservations regarding the new tool, one being the cost after the first year is complete. And the home provider's maximum licensing capacity is 12. And we are limited to the ability to increase our income. So we shouldn't have to offer like additional hours as a means of increase to pay for this after the first year. So it is very important that we receive the financial support. We all know that quality does cost, and materials and supplies are ongoing. So with all of that in mind, I am truly looking forward to working through those concerns with the help and support of the field, hoping that this new tool will be beneficial to not just the provider, but also the community, as we all work together for the children and families that we serve. Thank you.
Thank you, Cheryl. Really appreciate your thoughts and comments. To your point about sort of ongoing cost, I'm going to ask Natalie to rejoin the conversation. She and I had a bit of conversation about this just yesterday, and I just want to ask her to share her perspective on the issue of sort of assuming the cost of this kind of a, of a subscription service.
Yeah, I guess I'll offer just a couple of different things, which is that, I think again, sort of thinking about this framework of who benefits from this tool, it goes beyond the provider, right? So I would argue that there's really these benefits to families and children, benefits to providers, and benefits to system actors and partners. And so my recommendation would be for this group, and I think in particular the advisory group, to really think about how to plan together to support those costs over time, and that does not just be a cost that falls, solely on providers, but that there are, ways of thinking about, and we, are talking to lots of communities around the country that are thinking about how to support the cost of the infrastructure of networks. And so, my advice, if you're asking, Kathy, is that, this should be something that, all those beneficiaries and participants are thinking about and planning together sort of for the long term. And we do know that in other communities, folks are thinking about how to use administrative dollars for childcare subsidy to do some of this, thinking about whether quality dollars can support that. So I think there are different options to be kind of considered, and that really placing that as a priority for your planning and advisory groups, is a way to think about more broad community planning around how to maintain this for the long haul.
Thank you, Natalie. That's really helpful. And, I think you made a point. I just want to, kind of emphasize that Morgan, who is our lead for launching this strategy around Ready Network, is very interested in bringing together an advisory. Some folks have already agreed to join, and she's looking for additional members to make sure that this initiative can be led in such a way that the providers themselves can be part of shaping the strategy. I do think I'm very encouraged that our state leaders, and Jenna and Duke both seem to, really understand and support this idea of making this service available to providers, and have, in some ways, we have been able to fundraise from private foundations for, giving sort of this trial basis for many of the providers. But then also, I think there is an understanding and a commitment of some public dollars to help support this sort of first year trial and covering the cost of the subscriptions. I think the ongoing cost is going to be a conversation, but I am encouraged that there seemed to be an understanding and a recognition of the importance of the service, for this industry, because of, as you so nicely described, Natalie, the benefits that accrue to others as well. So we look forward to continued discussion and really seek your opinions and your feedback on this. And we would love to understand more, either through the question box or by direct email to info@vecf.org about your interest in learning more. We're also working with our Smart Beginnings in many of your communities to push out this opportunity, as well as with our colleagues with Child Care Aware. So really appreciate that partnership. I think one of the things we'd love to do now is, we've got a couple of polls. We are interested, very happy to bring this webinar to you all today, and this briefing, and sharing more information about resources and funding and opportunities for this industry. And we'd also like to run a couple of polls to understand what your priority needs and wishes are. And could I ask my team to go ahead and launch one of the polls so that we can take a pulse from folks about what would be most useful to you. So if you can see it, if you're on your laptop and can see the screen, and check off the top 3 of these items that you believe would be most helpful for your business. We'll just give folks a couple of minutes. Looks like we're close to a third of you finishing the poll, and it's inching up. We would love to hear from all of you, so we'll give it another minute or two and then see if we can take a look at the results. All righty, just one more minute. Okay, shall we wrap up and see if we can take a look at the results? Okay. Super helpful. Looks like bulk purchasing of food and supplies and professional development training are the top. And then automated billing tools and help getting licensed or maintaining license trailing by other. And I guess we'll have an opportunity to see what the other responses are. Thank you for participating in that poll. It's helpful for us as we think about and make plans for additional supports for you all. I think we have one more poll that is similar, but gives us a little bit of a different picture of your needs and wishes. Can we go to the next poll, please? All right, this one is around communications resources that would be most helpful for you. And again, you're able to choose the top 3 of these options online on the screen. Can we see our folks able to weigh in? It looks like on my screen that the poll is closed.
Kathy, we're getting some comments in the questions box that people are not able to click on them or to make a selection.
Okay, I wonder if it could be launched again. My screen says that it's already been closed, so I wonder if we could just try again to relaunch this poll. Is that possible?
It does not seem to be letting me launch it again.
All righty, well, it must be as tired as all the rest of us are. Well, thank you for giving it a try. And I guess what I would ask is if folks could, if you have responses or feedback on this particular question, if you could put it in the question box, that will be helpful to us. Again, we're just trying to get a sense of what your greatest needs are and figure out how we can be as responsive as possible. Just give y'all a minute more to, in case you want to enter any information in the question box. Okay. Thank you. I see that coming in. It looks like marketing is the one that is cropping up the most frequently in the question box. Marketing, advertising, online enrollment, those seems to be the top choices. Thank you so much. Feel free to continue to add those to the question box. Morgan, let me see if there's anything that you'd like to add in terms of this experience and how the launch is going, anything that you'd like the providers to know about.
Just that it is very, very important to us that this is informed by the field. And so want to make sure that we have a strong advisory team who can really help guide this process of tenured, savvy family child care providers like all of you on the call. So thank you for the comments that you've been giving. And also just want to
thank all of our first regional hubs who have been piloting this effort. So in Hampton Roads, Greater Richmond, and Southwest Virginia. They've already been out there talking with folks about this. We have a few people recruited so we can see how this goes and make adjustments as we move forward. So just want to thank all of our family childcare providers and our hubs.
Thanks, Morgan, much appreciated. And Natalie, as we come to a close, any kind of closing thoughts that you want to share?
I just want to say thank you so much, Kathy, for including me in this meeting, and just to really recognize the amazing work that you all are doing. The sort of vision for bringing networks to providers, I think, is so exciting. I'm also really so excited to hear from your state administrators and leaders around their commitment to home-based childcare, and to spend, this little bit of time with, the amazing providers in Virginia who are doing such incredible work on behalf of families. So thank you for including me, and I really do wish you all the best of luck as you move some of these ideas to reality.
Oh, thank you, Natalie. Much appreciated. And we will stay in touch because it's so helpful to us to have your perspective and to understand that there are other states who are testing out some of these same strategies. And it may not all be simple, but we're able to learn from other bright spots. We've been having conversations with both North Carolina and Tennessee, so nearby and adjoining neighbors, about pushing out strategies like this and how we can work together, learn from each other, and find resources to make it possible. So it's always good when we have company with what we're attempting to do. As we close out today, just want to thank all of you who took some time out of your day, stepped away during nap time, or found a way to join our conversation. We're really grateful for the feedback that we've been able to get from you today. We'll be sharing the recording and the slides. Afterward, you'll receive that by email. And I've noticed in the comments so many requests for additional webinars or briefings to learn more about this, and we will definitely find ways to share additional information. And again, thanks to all for the partnership. Cheryl, thank you for your comments, and appreciate the work that you providers do every single day. Best to each of you. Thanks again. Have a great afternoon.